Hey guys, this is Stephanie with Empower Physical Therapy, and we have Hillary, who is also one of our physical therapists at Empower. And today we just really wanted to talk about like back pain and how mismanaged it is, and what we hear all the time from our patients on just sometimes months, if not years, of issues that they've been having going through the whole medical system and not really getting the results. So let's just start there. Let's start like what do you typically get as exercises? I mean, we see like when we ask our patients, oh, so you went to physical therapy before, great. So what what exercises were you given? And then there's we know it like classic textbook.
Yeah.
So what are some of those exercises that were given that if you see this, you need to like stop and say, no, I need to get out. I'm wasting my time and wasting my money.
Right. All the time. It's knees to chest on your back, bridges, clams, hamstring stretching, lower trunk rotation.
Yes.
And those are exercises that are just moving you in all different directions. One might be really helpful, and then the next one, might not feel that great. Again, too, they might not even check in with you during the exercises until the very end of the treatment, because you're working with a tech or something like that. But we find that people end up doing the same exercises, even if they have completely different things going on too, which is also interesting.
I think it's also funny because we'll also hear like, well, I can do this at home.
Yeah.
And so then they're like, okay, well, physical therapy doesn't really work because I did everything. Or I've even had a patient tell me they went to a physical therapist and the physical therapist said, oh, you're doing everything that we'd give you. And I'm like, are you kidding me?
Yeah.
It's crazy. And then you go to a doctor and, I always tell people like, if, going to a specialist and they're spending 10 minutes with you, they're not going to be able to figure out what is going on. So they typically say, okay, well, let's go and look and check it out. And let's go do an MRI. So let's talk about like why that is probably not your best option either.
Well, first of all, a lot of back pain is mechanical pain, which is you have to move somebody to figure out what the problem is, because it's mechanical. So, if your specialist or doctor isn't moving you, or even asking you kind of like positionally what's better, what's worse, what makes it feel good or not, you're going to need to get into that a little bit. But most of the time, they'll kind of jump into an MRI and say, hey, listen, let's get an MRI because we want to see what's going on. But your MRI is going to tell you everything that's going on, not the one thing that's actually causing the pain or symptoms. So really, like Stephanie says all the time, it's an expensive selfie. It's really expensive for giving you really not a lot of information at all. So we like to keep that as like a last step. When, or if we'll screen you and tell you, hey, listen, we think you need an MRI.
But you had some red flags.
It's very rare. Yeah. Very rare.
And it is very rare. But usually it's because there's some red flags that are going on. And I always say too, like where the side of the pain is often not where the source of the problem's coming from. So maybe you have a hip component, maybe you have a thoracic spine component that could be feeding into what's happening. And so you're basically only taking a picture of one area. When you're not moving, when you're lying down, which you probably don't hurt as much when you're lying down, it's when we're moving or doing activities that create it. So it's an expensive selfie is the best way that I like to explain it. And when you look at the research on it, it's not great. I mean, if you take, I always tell people, if you take 100 people with no pain whatsoever, 60 to 80% of them are going to show something, but they have no pain. So if you have pain and then your imaging, was that something that was there before that is just a part of aging? Like I always say, you have wrinkles on our face. That's what happens as we get older. It doesn't mean it's bad. It's just part of what happens. Well, we get wrinkles on our bone, degenerative changes, decreased height space in the joints, but it doesn't necessarily mean that's causing your pain. And that we need to be fearful of that, or that you see arthritis. We get it. It's like there's a lot of people that show arthritis, but yet they have no pain, but it's on their imaging. So it's just frustrating.
It does. It's frustrating because it instills fear in patients too, because they're seeing all these things on their MRI. which, they might have had for 10 plus years and their back pain started last week. So it's really, it doesn't correlate very well. And the last thing we want to do is have you be fearful about something that, we can tackle with physical therapy and not surgery. Avoiding surgery is the key there.
And it's really important to know this information, because this is where when you have issues, you start talking to family members, friends, people that have had issues, and like, oh, you need an MRI to see what's going on. And so then all of a sudden you're like, I need an MRI because I need to know what's going on. And it's really expensive. And you don't necessarily, if you get to the right person, you don't need that. Like, save your money on things that will give you some solutions as to what you're doing throughout the day that's creating some of the problems to help you navigate this and get you back to living. But you'll hear that all the time. And you'll also hear, oh yeah, don't do physical therapy. They're not going to help you because of the same reasons that we talked about at the very beginning. But if you have it, you feel in your heart, like, I feel like I'm in the right place and that that they can help, then you need to go with your guts. Because don't let someone talk you out of it.
Yeah. And not all PT is the same.
No, not all doctors are the same. Not all chiropractors are the same. Exactly. Yeah. I mean, it's in every industry.
For sure.
Well, let's talk about too, because the last thing, like, people say like, oh, you need medications or go get an injection. That's what's going to really help you. And a lot of times they're frustrated because their pain came back. It didn't help them at all, or it only lasted for a short period of time. So let's talk about why that happens.
Well, so I've seen a lot of patients recently who come in and they say, yeah, I've been to my doctor or the specialist and they just gave me like a muscle relaxer. That is an expensive appointment to get a muscle relaxer that's just going to cover up the symptoms that you're having. And the reason why you're having your pain is not even assessed or evaluated. So a lot of times the steroid injections, medications, those are things that are not going to actually address where the source of the problem is. So let's start with injections here. Injections will help with chemical pain to reduce inflammation. A lot of times with like a really acute injury where say you come in and this just happened yesterday, and got a lot of swelling and that type of thing. We can't do certain things because you're guarding that and whatnot, because there's too much pain and too much swelling. An injection might be something that will help. Now, if this is something you've been dealing with for 2 years, 6 months, and you're going to get an injection, it probably won't help. And then if a doctor says, well, hey, you need 3 for it to work. If the first one didn't work, the second one's not going to work well. It's just because it's not addressing where the pain is coming from.
Yeah. Yeah. And it's, on rare occasions have I seen the second injection really work, but they also need, even if you do have that chemical side of things and we say like, what injection may help you, which doesn't come out of our mouth very often, because a lot of times if you can change your position and make it better and worse, if your pain can come and go and you can, change it, that's all mechanical. That's where you need to have a mechanic, someone like us that we can sit down and evaluate you and figure out what's going on, that we can help you. But you need, that's where you have to get to the source of the problem, and the chemical side of it's not the source. Often it's not. Even if you have some issues with the chemical side of things and you do get an injection, you're still going to need to look at your mechanics, still look at like, what are you doing throughout your day that might be creating some of your problem, coming up with a game plan around that. Is sleeping an issue? Well, we've got to come up with a game plan. Maybe it's not the bed, which everyone talks about. Maybe it's your position that you're sleeping in, and we've got to come up with a game plan for you on how to address that. So there's a lot of factors that go into play into really figuring it out. And the problem is our healthcare does not have time to address any of it, to give you any kind of education. It's in and out. You can go to a physical therapy office and they spend, maybe 10 minutes with you and then brush you off to doing all of your exercises with a tech, or while they're seeing, 1 or 2 other patients, because it's just the way the healthcare system is right now. Or you go in to see a chiropractor and they don't spend time with you and it's crack and go. You have to find people that are going to spend time with you. You will literally save more money by doing this and saving heartache and your time. Your time is so important to get back to doing the things you love when you can find the right people. So we really wanted to do this piece to really give you guys some education as to what to look for that might be a problem. Oh, one other one we never talked about, core strengthening.
Yeah.
Core strengthening is your problem and you need to have more core strength and that's going to help your back pain. Totally not true. But you can use this to go think of all the red flags. I'm like, ooh, I need to get out of this place. This place is not going to help me. These aren't going to help me, because you can use this video to understand why. And that's the key.
And if your physical therapist isn't taking baselines of your motion, like having you come in and looking at where you're limited and restricted and then doing an intervention and then retesting to see, did this work? That's another thing that, just you want to look for that. You want to make sure that they're really spending the time to see if it's working and checking in.
Yeah. I can't tell you how many patients have come in our office that said they wish they found us sooner, because we were the only people that gave them an idea of what was going on and what they were doing and why they were having these issues of things that they're doing throughout the day, as well as coming up with a game plan week by week to progress them through, to get them back to living like where they never thought they could.
Mm-hmm.
Well, thank you guys so much. We are very passionate about this topic because we see stuff like this all the time. And it is so frustrating when we see patients go down this route of not getting information, education as to why it's happening. And they're just hurting for months and years.
There's a lot of information out there. A lot of people are going to give their 2 cents. And so it's hard to kind of know who to listen to, and a lot of external factors, but we just wanted to make sure we addressed it to get you to the right place, get you better.